Well, I've seen a lot of changes in my career in pharmacy, but I think the most significant change is that I've seen pharmacists move to the bedside. And I think that's been the most positive change that we've had. Education has changed, not only for pharmacists, but also for technicians, to enable pharmacists to work at the top of their license rather than lower down in their license. And so I think those have all been very positive things. I think the growth in residency and residency-trained pharmacists has been very important. As a matter of fact, at Rush, over 90% of our pharmacists are residency-trained. And over 70% or over 75% are board certified. So that's a major change that we've seen, especially in the last few years. So the quality of care we can provide is very good. But there are many challenges out there, and the Affordable Care Act has challenged all of us and challenged especially hospitals. Most of them, frankly, with the situation in Washington, D.C., where they don't seem to be able to make a decision, most administrators don't know what to do. But what most of them have done is lean down their organizations and be prepared to move whatever direction healthcare goes in the future. And so that's created problems in terms of expanding pharmacy services. And I think that's one of the issues that we have. I think the other big issue is that we're not providers in the CMS plan, and so pharmacists need to have provider status. And I think once we start getting paid for the clinical work that we do, we'll be able to continue to expand. I think there's also opportunities, and the big opportunities is there's not enough primary care in the United States. And one of the things we found here at Rush is if I team up a clinical pharmacist who is board certified and residency trained with about 5 nurse practitioners don't know the drug therapy that the pharmacists do, but the 6 of them tend to work very well in a team and tend to provide all the primary care support services that we need. So I think there's great opportunities for pharmacists in terms of working with nurse practitioners and physicians' assistants in terms of providing primary care in this country, and those are where I see the opportunities.